Hello to everyone, dear participants, and we are starting our webinar dedicated to auriculotherapy. And let's discuss the plan of the webinar first. First of all, we're going to talk about the ear as a reflection system. Then we will go through the role of auriculotherapy in complex therapy. And also I will share with you the features and some secrets or life hacks of auriculotherapy module by VedaPulse. And in the end, you would be able to ask the questions, and I will be happy to answer them. My name is Sergey Kosintsev. You can see me on the photo, and I am the developer of this module. And my educational degrees, I am a Master of Metaphysical Arts, and this is like my European education field. And by my first degree, I am a medical doctor. My basic specialty is reflexology, and by reflexology here I mean any influence that may be caused to biologically active points, and also I am a PhD. The scope of interests of mine are multicultural metaphysical arts, traditional medicine, complementary and alternative medicine, bioelectronic medicine, biohacking, and meta-training. And briefly on 5 metaphysical arts, how they are understood in traditional Chinese medicine. Those 5 metaphysical arts are 5 ways of dealing with energy, of working with energy. And those arts are not separate, they are united, they have to be implemented together, they complement and strengthen each other. The first art is called the mountain art, and this group of art is aimed at getting the energy, all the ways of obtaining the energy. And in Chinese traditional practice, those are Qigong and Tanzi Cuan. And among the йога у нас вы отнесли к аюрведическим или...
Ну, просто как пример.
And another example here is yoga. The next art is called fate. This is what we actually call astrology. The types of energy that are active during our date of birth remain active during our life and have a particular influence. The next group is prediction. It is based on finding the synchronicity with the current rhythms. In Chinese tradition, the example here is I Ching, the Book of Changes. In other traditions, those are oracles. The next branch is Yi Shu, and these days it is translated as traditional Chinese medicine. But this hieroglyph actually have the more ancient and more deep meaning. It was considered to be healing or translated as healing. We may say that only when the person has integrity of all the parts, then the person actually has the health, and the health becomes like a side effect of the total integrity of the body or all the parts. And the last art is contemplation. Contemplation art means the working with energy projections on the body. The Chinese interpretation for this group of arts is Mintian, or the reading of faces or screening of faces. And another branch here is Feng Shui. I think it is quite popular and you are acquainted with it. And this is the very direction, this is the very branch, the last one, that pays utter attention to the ears. Chinese people consider the ears to be the creature of the element of water, which is associated with the hereditary energy. The more bulky, the more strong ears you have, the more well express hereditary nature you have. Also, there are specific projection zones on our face that are responsible for our age. The ears reflect the first 14 years of our life. For example, in men, the left ear shows first 7 years of life, and the right ear shows the next 7 years of life, like starting the 8 years of age till 14. And it's different for women, as the right ear shows the first 7 years of life from the first year of age till the 7th, and the left ear shows the next 7 years of life between 8 and 14. In case the child is born with some specific signs or markings on the ears, you can try to predict some events that will going to happen at a particular age of his life. In case the marks or the signs on the ears appear after the age of 14, it means the changes in the organs or the body parts which are being the projections of this or that particular ear zone. And now let's discuss the history of auriculotherapy. The modern history or blooming of auriculotherapy as a method of treatment happened due to a French doctor, Paul Nogy. First, Paul Nogy tried himself in technical sciences, but then got carried away by medicine and started developing in this field. Once he saw on one of his patients' ears the odd signs on the ears, the signs or marks of the burnings. And then he asked his patient why did he have those marks. The patient told him that once he had a severe pain in the back, and one of the doctors, one of the specialists, tried this moxibustion method, and they got a great relief from the pain. After that, Paul tried the method himself, and he was convinced in its efficiency. He was interested by the method and started searching and started learning things about the ear concha. Around 1951, he discovered basic auricular projections, worked out the detailed mapping of the ear. He held the real scientific researches and studied the pain, tactile and temperature sensitivity of the ear, developed a method for examining of the patient through the ear. He tried to develop various methods of impact on the ear, and he tried to stop using, to find other ways than using this intensive moxibustion that left the stains and burning marks on the ears. He developed different methods of puncturing with special needles. He used massage, used different apparatus or instrumental methods. There are different stories and versions of Nogier being acquainted with the method, his scientific researches within this field. According to one version, he knew nothing about the Chinese traditional auriculotherapy, and according to another story, he actually met the Chinese doctors who told him about the auriculotherapy features. Biological active points were described in the traditional Chinese medicine long ago in Huan Din Yizin treatise, the inner canon of Yellow Emperor. But the ancient Chinese traditional medicine suggests the usage of the points as the separate points. And recently, lately, Chinese specialists use the modified Nogi method. Different countries and cultures borrowed the method, tried to develop it, perfect it, and the same thing happened for the Soviet Union, who borrowed the method also. One of the major things one of the major achievements in the work of Nogy was the discovering of the vascular autonomic signal in terms of usage it in the auriculotherapy. He discovered the vascular autonomic signal method for years in 1966. It did exist before that, but only in terms of vessels, and Nogy didn't know about that. He studied thoroughly the neuroanatomy of the ear and discovered the particular nerves that innervate the ear, the
Также,
particular reflex zones on the ear. He also conducted experiments on animals on auricular analgesia. I have to say that this is quite a powerful method even these days. He also discovered the resonant electromagnetic frequencies of the ear and their usage, their influence on all the body. He developed different tools and equipment for impacting the ear, the spring and electronic detectors. He used light impact on the ear and used different color filters for that. They are listed here on the slide. One of the latest developments of Nogy was individual selection of medicines under the control of VAS, or vascular autonomic signal. So what is the effect? So the method is you may use the homeopathic grain or particular herb and apply it to the ear biologically active point zone, and the device at the same time register the character of the pulse wave. There have been also studied the projection of the human or the embryo in the during the intrauterine life as the projection of the ear. So the lobe part of the ear reflects the head of the embryo, meaning that the human body is projected on the ear just in the same position as the embryo has in the uterus. Also, we should not forget about the tripod system. Here it is important to understand to what particular particular sphere. It is important to understand what particular sphere the auriculotherapy is to be associated to. And here I want some interaction from you. You can give it a thought and type in the chat. What do you think? Is it energy, materia, or information sphere where we could place auriculotherapy? A human being and any thing in this world can be placed under either one of these fields. Our body and anything that you could touch with your hands is materia. Our hormones, our emotions, our energetic state is placed in the energy field. Is energy. Information is those programs that are recorded within us. Information could be of a genetic or social nature. For example, what is the social information? For example, we all know how to communicate, but when we get born, we do not know how to speak, and we learn the speech due course. So this is like the social program that is being installed in us. Also, our mentality and the discrimination system, the ability to discriminate the good and the bad. And I see only two variants in the chat suggested by the participants. One of the variant is energy and another is information. And one of the full answers here is if ears are the element of water, it means that it is information. And this is the actually correct answer. Plus, the ears have a lot of nerves in them, and directly through the nervous system, the ears are able to influence the body, and nervous system has this influencing impact here. And so the nervous system becomes this information transmitter here. And according to both Eastern and Western ways of thinking, ears are considered to be the information tool. Why is it so important? Let me show you. As the person is considered to be the unite entity consisting of three pods, we have to use three different methods at the same time. So we should use all the three dimensions here. Physical level. Here we have the methods of Western medicine, massage, and manual therapy. And within energy dimension, the energetic influence might be the emotional therapy or psychiatry or psychotherapy, something like this, or the influence through the corporal BAPs or meridian points. And information methods of influence are homeopathic methods, EHF method, for example, mantras, prayers, and the influence through the ears. Once you complete the arsenal of your therapeutical tools by all the three dimensions, you will get the most efficient therapeutic collection for you, for your work. And now we go directly to the Auriculotherapy module by VedaPulse. To carry out the efficient work with the VedaPulse module Auriculotherapy, you have to know like the minimal aspects of the anatomical structure of the ear. In the module, you can find all the tips that would be that you may find necessary for you. Aside of that, you may try to learn to observe the real ears in real people. It would be helpful. Of course, the general structure, the general anatomical features of the ear are common for everyone, but each particular person has its own has the nuances of the ears. And the major mistake of the beginners here, which you should avoid, it's like the common mistake of our conscious. It is typical for the beginners in any area of the science or anything that you study. Beginners usually tend to search for differences and build their assumptions on that. For example, they see any difference between the people and they say like, this thing differs from this example. It means that I should use something different. But you should try to learn to see the same thing in different places. And applying it for the ear particularly. You should try to learn to find the particular zone of the ear in different ears. For example, when I studied auriculotherapy and then I taught other specialists to use the method, we studied the ears of each other. We observed the ears of each other to learn to see the things in them. So do not forget about that. And now the features of auriculotherapy module. The module is the result of a great work, and it takes into account many nuances and details. You would always get the personified or individual recipe because module takes into account constitution of the person according to Ayurveda and meridional features of the person according to traditional Chinese medicine. There is one of the important features of auriculotherapy is that it is important to choose the correct ear to start with. We have a leading ear, and there are the points on the leading ear which may be found in another ear, and they are like additional and complementary or supportive. There is a special test inserted into the module that helps you to identify the leading ear. The module provides various methods, prophylaxis and healing methods for 126 disorders, and they all build on individual-based recommendations. You can use the nosological filter to choose the particular disorder for generating the recommendations. Also, the program provides you with the tips on the duration and the methods of influence for specific points. You can click the point, any point you want, and read the additional information or description of the point in the program. All the description texts, the additional information on the points and so on, you can save and print for yourself, either for your patient. The program contains information for educational purposes and for therapeutic purposes on the 128 points of the ear shell. You can search the particular point by its number or by clicking on the anatomic zone of the ear. There are different nomenclatures or systems of numeration of ear points. The first 100 of the points usually match in most of the countries. But after the first 100, there may be some differences. Don't forget about that. Remember that the numerical meaning of the point may differ for different countries. In the module, the ear is divided into 18 major zones. You can choose any zone that you want to check and find out the name of the zone. You can do it by two different ways. Either you should click the BAP atlas and see the name of the zone. Here on the slide you see the navicular fossa. Or you can click on the zone on the ear itself and see the name of the zone in the description window. Or here you can click the very point itself. Here you see the lobe zone. And here the point is chosen and it is called the tongue. Here you can see the description of the point and its location. Also, you can find the point by its number, but this is the information for those who have dealt at least a bit with the program. With the points. Here in the Atlas BAT, you should choose the line find by the number of the point and just type the number of the point in the window on the right. Here it's just 100. After you typed the point number, you could see the zone of the ear, the zone of the location of the point highlighted on the picture, and you would see the biologically active point itself marked. There are different types of biologically active points, and you can see the variants here in the legend on the left. The point that has the number 100 is called the heart point, or the point of the heart. This is the type of point which is not being actually a point in terms of influence, but she has the certain like diameter of influence. We can influence the zone around it. Those points have a bigger size, we may say. So the beginners are fond of those kinds of the points because they can reach them easily, and they would not miss them with a finger or anything. And here, one of the most efficient method of influence would be the usage of the stick. So how do we start working with the module? It is necessary to pass the test for choosing the right ear. As I already mentioned, there are the points that are being located on the leading ear and the subordinate points being located on the subordinate ear or the secondary ear. This is based on the researches within neurophysiology and such phenomena as laterality, like the leading hand or the leading eye, the leading leg, and so on. After you have passed the test on the leading ear, you would be offered the methods of influence. In case you do not know for sure what exact method or what exact condition you want to aim to in the person, choose normalization of the functional state graph. We may say that normalization of the functional state is quite a universal thing, and the recipe based on it would be quite universal for everyone, but anyway, we have a personified program, and the recipe would be individual anyway. And anyway, you can see the description, the information on any point in the recipe. For example, you see the 34 point in the recipe and you would like to know where it is located. You can click on the point and you would see the zone highlighted on the ear. So you would always be able to find the point, to see its name, and to find the zone of its location. And in this particular case, the zone is called antitragus. And you will get the detailed description of the location of the point. It is here in the bottom. This is quite an efficient point. You can use it as an independent point for calming. It also may relieve the fatigue in case of prolonged mental exhaustion. You can press the antitragus from both the sides and massage it a bit. The size of your fingertips is anyway bigger than the size of the point, so when you press the antitragus zone with your fingers, the point will be there under the pressure, so you would influence it. Also, such a massage would stimulate the cerebral blood circulation. But such type of a massage is kind of invigorating, so do not perform it before going to bed. Let's check what nosologies are there in the module. There are different nosological groups united by the physiological systems. You can carry out the selection according to the name of the disorder that the person has or the complaints. After you have chosen a certain disorder or a group of disorders in the nosological filter, you can choose the particular condition. Let's check what can we get in hypertension, for example. So we have chosen hypertension in the filter and the program provided us with a recipe. You can see different points highlighted in the ear. You can click the points one by one or go along one by one, influencing the points step by step. It is important to mention that each particular point would not only relieve a particular condition, but also have a general beneficial effect for the metabolism. Let's see the example from the slide, and it is the point 59. This point is named to be the point lowering the blood pressure. This is the unique feature of this point. But you can use the same point for many other conditions. For that, you should know, you should go deeper into anatomy and projection nature of the ear. And now I want to check if there are any specialists who really specialize in the anatomy of the ear. The zone where the point is located is called the triangular fossa. If you remember the picture of embryo in the uterus, try to guess what this point may also influence. And please text it in the chat. And there would be not only one additional sphere of influence, if we may say so, but two. And the first variant is already there in the chat, and it is feet. Another suggestion here is kidney. It is wrong. But you are close, because the direction is close, but you just didn't hit the target. A couple of seconds for more versions. While you are guessing, I will tell you about the methods of influence on the points. You can choose the method of influence basing on the skills that you have, the area of medicine that you use. The easiest way of influence is acupressure. Usually we get point massage with such sticks with spherical tip. Also, you can use needles in case you specialize in using needles or needle puncturing of ear. It is great if you have Veda laser, you could use it to make an influence. But you should always take into account one nuance. The biologically active points on the ears are much more sensitive than those that are just on the body, on the rest of the body. So you should barely touch the ear with the tip of Veda laser, or you would get the intense, painful sensation. And the pain sensitivity of the ear point would grow in case the point is associated with inflammatory processes. There are also special spherical pellets, tuba pellets, for the ear auricle. There are metal pellets, but I personally do not recommend you to use the metal pellets. For example, it is so typical for Russian patients to think that if you want a greater influence, you have to use something for a longer duration or to a greater extent. In case you placed a spherical metal pellet on the ear of the patient and recommended the patient to massage the place a couple of times and then remove the tape after 1 day, the patient usually tends to keep the tape on the ear and keeps massaging it to get the greater effect. Such an influence may seem quite effective at first, but then it may worsen the condition of the patient. So it is better to hold examination every now and then. For example, you can repeat the VedaPulse assessments every 3 or 2 sessions. This would allow you to use the more relevant or actual recipes for the current state of the patient. You can use the grains or seeds. Also, the silica gel spherical pellets are good for use. Silica gel is the specific substance. For example, you could find it in the boxes with new shoes, in the small bags. Silica gel is good due to the fact that it gets disintegrated fast. There is a question in the chat. What types of grain can we use? Can we use buckwheat, for example? Our expert says that yes, we can use buckwheat, but only with highly conscientious patients, because the buckwheat seeds are quite harmful. They have the like the rough edges that may hurt the ear. You can find the spherical palettes of different types in different online shops and markets such as AliExpress, for example. One of the shortcomings of such a tool is that the tape gets dried fast. And again, the question from the chat, what types of grain the specialist uses himself? And our expert says that he uses those grains that he has at home or at the office. And for example, this type of spherical pellets from AliExpress or the silica gel pellets. And another variant in the chat about the zones on the embryo is navel. No, it is wrong. And the zones of the influence that correspond to the triangular fossa in the embryo is the lower pelvis zone. For example, the ovaries in women are in this area. In men, this zone may be used to influence the stagnant or congestion conditions in the area of the minor pelvis. Also, the points that are located in the triangular fossa regulate the sexual hormones. This is pretty much it that I wanted to tell you about the auriculotherapy module by VedaPulse, and now I'm ready to answer your questions, and I already see some of the questions. And the first question is about Veda laser. Is it infrared radiation? No, Veda laser is a red laser. I know that Paul Nogy recommended infrared radiation for the influence, but me personally, I do not see any physiological explanation of more efficiency of usage of infrared radiation than red radiation, simply. The infrared type of laser or radiation is used in the cases the specialist needs the deeper penetration into the tissues. And you see that the depth or the thickness of the ear auricle is not more than like half of a centimeter. And the simple red laser or red radiation goes through the ear auricle, passing all its thickness through and through easily, because the length of its influence is between 2 and 3 centimeters. One of the reasons why we may consider infrared laser more efficient if we want like more natural warmth. Another question in the chat is about the name of the grains on the plaster or sorry, on the patch. I do not remember the exact name of the Chinese plant, the grains of which are used for this the spherical pellets for this patch thing, but you can find them in the internet or on AliExpress or something. So the first question in the question chat is what is the influence of piercing the ears? And we guess this is a question about piercing the ears to wear earrings in the lobes of the ears. There are several important things here, and I will talk about them in details. The classic way of piercing the earlobe is to pierce the point which is called the eye point. In case after the piercing you do not get the swelling and pus and inflammation, it means that everything went fine. In case you get the inflammatory reaction, it may have the bad consequences, including the bad consequences for vision. In case someone needs your advice on the piercing of the ears or you want to do it yourself, It is better to choose not biologically active points on the ears, but the place near them. Me personally, I tend to negatively, I have like a negative attitude to any piercing of the body in any place or
Uh,
any part of the body. I know that there are cultures that have this thing as a common thing. But do not forget that those cultures consider the specific rules of doing the piercing of the ear. They have the particular goals of the piercing or pricking of the ear, they choose a particular day and have a particular ritual around it. For example, a belly button piercing can can drastically change your energetic levels in a bad way. To avoid this situation, in case you want to pierce the belly button, you need to choose a particular correct lunar day of the lunar cycle and know the positions of the planets. Another thing which is popular, the piercing of the ear using the rings along the helix. Pricking the ears in the zone of helix, along the helix, or could negatively affect the spine, the immune system, and the system of chakras. So I would advise you to think a lot before you would pierce the ear. And energy-wise, the most tender and the most dangerous places or parts of the body to prick are the ear and the navel. And another question in the chat, what types of pain meant in the test, head, ear, or any part of the body? It doesn't mean what part of the body. The most important thing here, the side of the body, left or right. Another question is, what is the expiration term for the recipe? The condition of the person constantly changes, and the other day we may get another recipe for normalization of the functional state relevant. In case the person had a dramatic change in the condition, either to the positive side or negative side, it is better to carry out the assessment, another assessment. In case there were no dramatic change in the condition of the person, I recommend to carry out another assessment after 2 or 3 sessions of the treatment. Another question, in case the disorder is not there in the nosological filter, does it mean that auriculotherapy cannot be used for this disorder? And the answer is no, yes, it can be used. Some disorder may require the specific approach of the influence. Anyway, the normalization of the functional state mode is suitable for any condition anyway. Another question, please recommend the biologically active point for influencing the migraine in exacerbations as the urgent therapy. This is the question. This question is quite hard to answer certainly or clearly, because it is important to understand what you mean by migraine, because there are like 2 different definitions. One is used by common people, like folk definition, and another is like the real nosology. In case the migraine was verified or detected as a verified medicinal condition, we may use the ear in particular for particular influence. You should start influencing the point just at the very beginning of the development or the arising of the migraine aura. And those dealing with clinically verified migraine should know about the aura state. And here you can use the 34 point. We have seen it today. It is located, it is influenced laterally, only on one side, on the side of the pain. And secondarily, you should influence the points associated with the digestion. Ideally, here you can use the point of liver. Migraine is always a sign of metabolic disorders. The metabolic disorders. It means that you consume the wrong food. It means that you should control your diet and stop triggering the migraine by using the wrong food products. In case you consider migraine as just as a lateral severe pain in one side of the head, for this case, you could use the points associated with the cervical part of the spine and then use the point number 34. It would be efficient only in the case when you start the influence at the first signs of the painful sensations. Another question is, the recipe is provided for 3 days, but the course consists of 15 sessions. So we should, after the 3 sessions, we should carry out another assessment to get another recipe for the following sessions. Yes, it is correct. And the next question, in case the person assessed with a great imbalance of Pitta dosha, but there is no particular diagnosis, meaning we cannot choose a particular disorder in the nosological filter, could we get the recipe anyway? And the answer is yes, but we need to think of the particular framework here and remember about the tripod system. As I already mentioned, the person consists of 3 parts: physical, energy or emotional part, and the information part. Dosha itself is an informational dimension. The way of manifestation of the doshas are the emotional manifestations, so this is like the energetic level. The problem originates on the information level here. The problem originates in the level of imbalance of doshas, and this is the informational level. But it manifests through the energy dimension, through the energy level, through the emotions, and later through the physical level. As our program estimates the results basing on the balance of doshas and channels, we can get the recipe without the particular disorder specified. And this is actually the best stage of influence before you get the actual manifestation. And here you should remember the major metaphysical principle. The thing we aim our attention to is the very thing that gets multiplied or gets bigger in size. In case you specify to a patient that you want to work on his or her anger or emotions, you would get the controversial effect, so the anger would grow. So you should not fight the symptoms, because any fight ends up with failure. We should work on fortification or facilitation of his weak points, or direct his energy or his attention to the good focuses. You can tell your patient that you need to work on increasing the energetics and strengthening it. And for that, you could use the recipe provided within normalization of the functional state. As it takes into account the balance of doshas and the balance of meridians, the energy levels would improve in qualitative and quantitative way. Thus, we would strengthen the person through normalization of his energetic and information dimensions. The next question, does the tattoo have influence on the body, or on our energy and our health? And the short answer is yes. I will clarify. Tattoo itself is nothing but a scar. The skin under the influence of the tattoo needles become coherent, and coherent parts of the skin lose their movement ability. And when the movement ability is lost, it means that no energy can pass through this area, and this, of course, has the influence on the health. And if we look at this problem as a deeper psychological issue, the person who is eager to do tattoo on the body has some inner unresolved pain or an unresolved problem. So they try to change to find a relief from this unresolved pain and express it and suppress it by changing one's own energetics. But it is not possible to do it right when you do it unconsciously. It would not be enough to use only auriculotherapy here. It would be necessary to go to psychologists and try to find out the deepest problems. Among traditional Chinese methods, the biorhythms method would be efficient. Here, biorhythmology relieves the problems associated with deep emotional, psychological traumas or problems. And the next question is where to learn or where to study to perform the needle therapy or the needle puncturing. It depends on your residence, your purpose, and your education degree. Remember that Chinese people consider needles as weapon. So before you start using a weapon, you need to try to learn to use something else. You should start with correction of lifestyle, nutrition, and correct selection of medicinal plants. If you like to work with biologically active points, you can master your skills within massage, laser therapy, or moxibustion or warming with dew. Aside needles, there are more effective ways of influence. The next question is, there is a cross mark on the lobe of the ear in the young lady. What does it mean? It depends on the particular part of the lobe where the cross mark takes place. Usually it is associated with a hormonal imbalance. Or it may be increased levels of cholesterol in case the person is overweight. How could you comment on one of the folk methods of relieving the pain associated with the scalding? In case I have scalded, for example, the fingertips of the left hand, I supposed to take the ice and press it to the opposite ear, meaning the right ear, and it brings the relief to the scalding fingers. I do not know the certain answer to this question. I can only elaborate. So first of all, when we use this cross influence, we switch on the hemisphere which is responsible for the opposite side. There is certain neurophysiological ground under this phenomena. Also, there is a specific omega point on the ear auricle, and this point has an analgesic property. So those are my suggestions for this phenomena. And the next question is, in case the person already has the scars, can we restore the flowing of energy in those areas? Sometimes it is possible. For that, you could use the magnet therapy and specific ointments. I cannot provide any certain recommendations because I have not seen the scars, and this requires the personified supervision. So the next question is what points could be effective for kapha constitution in the weakness of the spleen, and our expert says that he should obtain the complete information about the patient to provide the recommendations. Besides, the state needs or requires the influence on corporal points, and auricular therapy would not be the most efficient method here. We ran out of the questions. Thank you a lot for attention. I hope it was useful for you. You can use the module for yourself and for your clients. Goodbye.